Okay, hello to everyone. First of all, I would like to thank all of you for being here. And especially I would like to thank Case & Company for giving us the opportunity to stay in touch in this very, very tough period. I know in this time, the coronavirus is spreading all over the world. And especially in Italy, as well as in the United States, we have to do a great effort in order to overcome this problem. And this kind of cultural activities can help our mind to be distracted and forget the virus, even if, unfortunately, only temporary. Otherwise, these events give us the opportunity to stay up to date with the newest technologies and to focus some clinical application. But before starting, let me introduce myself. I am Baldi, Domenico Baldi. I am an Italian doctor. I study at Genua University, where I received the specialization in dentistry. I am a professor now at Genua University, where I teach and work, and I have also my private office in Genoa. I'm a professor at Bucharest University too, at the Titu Maiorescu University, and I am a member of many scientific society and the author of international articles. But this evening, I am above all a colleague that wants to share with you his experience with using this instrument, this magnetodynamic instrument during the daily work. Now we are going to speak about the new technique of bone preparation in dental surgery. I mean, the new instrument magnetic dynamic technology. So nowadays, when we started to work on our patient, fundamentally, we are looking for to be less invasive. And as I want to show you in these cases, we try to be less invasive using the last technology. Like this, we start from this situation and we arrived at this situation from a good situation from aesthetical point of view and surgical point of view, using a guided surgery. So we plan our surgery, and then we plan a workshop and virtual workshop, of course, and then we made a model and a guided surgery. And after we work in our patient in order to be less invasive, using this surgical guide, and then using this narrow implant, the 3mm implant that permit us to be less invasive and to finish our work in a good way. But even if we know that this kind of approach is really good from this point of view, to be honest, we can see that we made a mistake because we used, in order to be less invasive, a very traumatic instrument like contrangle, like burr. Because we know that if we want to be less invasive, we have to follow this kind of protocol, but we have to introduce in this protocol a new instrument that can permit us to work in this way. But to be honest, when I want to use a new instrument, I always ask to myself why I have to use this instrument and how this instrument works and when this instrument should be used. And this is the question that I want that do to yourself this evening. And I would like to share with you my experience in order to give you the right answer. So about why we have to understand, and we have also to analyze why magnetic mallet it could be useful. Because we have a necessity. We have the necessity to overcome the limits of precision and safety of a traditional bone cutting instrument. And when we speak about traditional, we are speaking about burr and manual osteotome. With the magnetic mallet, we can have a high predictability, and so we can obtain efficacy of the therapy, and we can also obtain low morbidity with less pain and less complication. The cutting action of the magnetic mallet are speed, precision, directionality, visibility, control, and the cold. Also, we have drill-free and cut-free procedures. And about this device, we have to highlight that there are 10 years of scientific research. So we have a lot of references that can help us to understand why this instrument can be really useful in our daily work. Because he used the biomechanics concept, principle of the bone, because we know that bone is flexible to absorb energy. Bone is able to change shape, to deform itself without cracking. Bone is able to widen in compression. Bone is able to lengthen with tension. Bone is inhomogeneous, not uniform, anisotropic, directionally independent, and viscoelastic. Thanks to this, it's possible to summarize that with magnetic mallet, it's possible to manage the bone surgery in a less invasive and a much more safety way. And why magnetic mallet is so useful? Because magnetic mallet is a magnetodynamic device able to apply to an insert osteotome and properly calibrated force, not only from the force point of view, but also from the application time. And so we can focus our attention to the advantages of this instrument that are bone condensing, osteodensification, rapid bone healing, precision and control implant access, a good visibility. And we have a lot of articles that confirm us this principle of this instrument about bone condensing, as well as about osteodensification. Also, we are about rapid bone healing, and also about precision and control implant access, a good visibility. So we can, in the end, say that why we have to use magnetic mallet. If this is the question, the answer are two: advantages for the operator and advantages for the patient. And if the question is how we have to use this instrument, we have to ask, first of all, how does it work? And again, if we make the comparison between the classical instrument and I mean triangle and burr, we can know that we can see that with the burr, we have a mechanical micro vibration. It means that we have 16 microwaves in 1 second. And so in order to have a good result, in order to have a good work of our instrument, it is necessary to have a pressure of 27 Newton. It means that it's necessary to make a pressure in 1 second of 2.8 kilos. So we can also understand that because the drill, the burr beats the bone during his rotation, the cutting resistance vector is constantly changing, and so we can have a limited control and lack of precision. And so in this image, you can understand how the burr works. So at the end, we can say that finally, we prepare our implant side, but we lost a lot of bone. Again, if we make a comparison with the manual osteotome, we can again make a comparison about the functionality. And we see that in 1 second with the mechanical instrument, with the manual instrument, we need to make a pressure of 240 and 94 Newton. It means that it's necessary to apply around about 20 and 30 kilos. And so when we use the hand mallet, we have a low force of bending waves produced by the hand mallet. As I told you, in average 60 decanewton in 300 microseconds, were found to depend on the density moment of inertia, elastic constants of the bone. This force doesn't induce a complete bone deformation, but push forward into cranial wall till the implantation of the neck during the operation, especially when we are going to do the sinus lift with a crestal approach. And displacement of the otoliths may induce pain in proximal positional vertigo. In this video, you can understand how this hand mallet works. You can see how it's difficult to manage the forces and how it's very difficult to manage the position of the instrument, how this force can spread in a very, very strong way in the other part of the bone, creating a crack of the bone. And if we analyze the magnetic mallet, we can see how it's possible to manage in a good way this instrument. We can have a good visibility, we can also have a precision, and we can control our work. And it's possible because here we have 4 forces, and we can start from the first one, where in this case we can apply 65 decanewton in 120 microseconds, and we can arrive at the first number 4, and then it means that we can apply 260 decanewton in 120 microseconds. So we can apply 260 kilos in only 120 microseconds. In this way, it's impossible to create the same damage that we created with the manual mallet. In this video, you can see how it's possible to manage this instrument. You can see here how it's possible to have a good perforation of our bone, maintaining the healthy situation of the bone without destroying the bone. And you can see the stability of our osteotome. You can understand immediately the difference between this kind of instrument, magnetodynamic instrument, and the manual instrument. Again, if we make a comparison between these 2 instruments, burr and magnetodynamic instrument, we can see the difference. Look at here. In this video, you can see how we work on the bone with the burr. Look how it is traumatic, but it's normal because we have a macro movement of our instrument. So we can perforate the bone, but at the same time, we unfortunately destroy the trabecula of the bone. And this is the final work. Look. Of course, here we have necrosis because we used the burr. Without spray, water spray, and so we obtain an overheating. But you can see in this position how it was traumatic for the bone. Look at the end when we place the implant. Again, you can understand immediately how it's important to know very well the implant that we are going to use. So it's very important to know the surface of the implant, but it's really important to know the shape of the implant, the threads of the implant, because sometimes the very big threads mean good stability, but sometimes these big threads are very traumatic for the bone. This is the final work. And if we analyze this microscope, in this microscope view, how is changed the situation of the cortical bone without using nothing, we can see that we have that in this image we have a microfracture after using the drill. Again, the spongy bone undamaged. And you can see the spongy bone, after using the burrs. And here you can see instead, if we use the magnetodynamic instrument, the mallet, magnetic mallet, you can see how we can preserve the bone, how we can maintain the structure of the bone. And it's very important. Look at here. It's impossible to obtain this kind of result with the other instrument. And now again, I want to highlight how much is important to use the right implant. Look at here, it's important to use the right implant because if you prepare in a conical shape your implant site, it's necessary to use a conical, a taper implant in order to have a correct contact between the bone and the implant in order to obtain a better and a faster, much faster healing of the bone. Here again, you can understand and you can see how it's possible to enlarge our implant side with the magnetic mallet. Look at here. We arrive here, now we enlarge it. And we can arrive at the end of our preparation, maintaining in a perfect way the bone structure. The other question is when we have to use this instrument. And so we can analyze the clinical application. And we know that it's very huge, the possibility that we have. In fact, we can use also this instrument in order to remove the crown, the bridge, but we use fundamentally in our surgery. So we can use this instrument in the tooth extraction. We can use it in the fresh socket implants, in the implant site preparation, in the all-on-4, for remodeling the bone with the bone condensity and ossification. And we can use also in the light implants with the bone expansion. And when we speak about bone expansion, of course, we speak about horizontal expansion and vertical expansion. Horizontal expansion means split crest, ridge augmentation, and vertical expansion, we speak about the sinus floor elevation with the crestal approach. If we make an overview of these opportunities, we can analyze all of these conditions. Of course, today we have no time to analyze in a deeper way all of this, but we can just see some cases in order to explain how it could be useful our daily works. But if we want, we can have some other meeting where we can go deeper in every kind of this application. But anyway, we can speak about the tips for the extraction. We have a different kind of tips. So we can have tips in order to make to use it like a periotome, and then we can use also some other instrument like lever. And you can see how it's possible, starting from this situation, to manage our extraction in order to be less invasive, in order to maintain all the bone around our socket. In this way, we are really a perfect socket preservation. And now we can decide to wait the healing of our bone with blood clot, or in other way, we can decide also to make a rigid preservation. We know that here there is two different kind of position. There is someone that prefer to wait the natural healing, some other prefer to make a rigid preservation. From my point of view, it depends. It depends from the situation that we are going to approach. Like in this situation, you can see that we prefer to make a rigid preservation. Another way, as a matter of fact, we know that there is a lot of literature that show us that after 6 months we have a dimensional change of our bone. So it means that we have an average, an horizontal reduction of 3.8 millimeter from the vertical point of view, instead we can have a reduction of 1.24. And there are many articles about it. But again, we can see that all of them tell us that we have a vertical and a horizontal resorption. And we did this test. We decided to make the extraction to this patient, and we decided to make in one side the extraction, and without placing no filler, nothing at all. In the other side, we place a filler in order to have a ridge preservation. And you can see in this CT how is completely changed the situation after 6 months. So you can see how in the right side, how it was resorbed the bone. Instead, in the left side, where we place the filler, we maintain a good quantity of the bone. And if we see the measure, we can see that where we had the root before making the extraction, we had a size of 6.40 millimeters, and the same place after the extraction, after 66 months, we had a size of 2 millimeters. It means that we had a very, very strong, a very, very high resorption of our bone. So if we analyze a clinical case like this, where we make an extraction of the lateral teeth, we decide to make in a traumatic way this extraction. You can see how it's possible to obtain an avulsion of the bone using only osteotome. In this image, in fact, you can see how with the Mallet instrument, it's possible to obtain the extraction of the root. And then with the forceps, it's very simple to take away the root. Then we place our filler in order to have a good ridge preservation. So, in few words, we can say that a less traumatic tooth extraction, we can have a much better bone healing. In this video, you can understand it's possible to do this extraction. In this virtual video, you can see that sometimes we have an ankylotic root, and with this instrument is possible to cut the ligaments and then to remove the first part of the bone that are ankylotic in order to have a compression of the hole, in order to have a mobility of the root. And then we can immediately have the movement of the root, and then with the forceps it's possible to take away the root. But if we analyze directly on the implant this situation, we can immediately see that it's possible to transform a virtual video in reality. And look at here, it is the same situation that we saw before in the virtual video. You can see how it's possible to manage this very difficult extraction in very simple. It became very simple. I want to show you another clinical case that is very important to see how it's possible to make the extraction in a traumatic way in order to place immediately the implant. Of course, if we work in the molar, we prefer to split, to separate the root in order to make in a very simple way the extraction of the root. And again, look at here how it was possible to make the extraction maintaining this thin hole of the bone, of the cortical bone. And the question is, do you think that it could be possible to do the same thing with another instrument? And the answer is very simple, because the answer is no. After this, we can prepare the new implant, the implant side, and we can so we can finish our preparation. And you can see again how it was possible to maintain this thin cortical bone. We did a perfect extraction in a very atraumatic extraction. And now it's possible to prepare here in the middle of the root to prepare our new implant site, and then we can place our implant. Of course, here I prefer to fill the hole and wait the healing of our surgery, and then we can finish our surgery. But with the magnetic mallet, we can also prepare directly implant site, like in this case, without cut the soft tissue, without flap, in a flapless way. So we can prepare immediately the implant side, and we can place 2 implants of 3 millimeters. And in this way, we can really be less invasive. So we can start from here using this kind of instrument that is magnetic mallet. This instrument with these tips, we can avoid damage to the bone. And if you use this instrument, the classical contriangle with the burr, you understand that it's impossible to be less invasive, as well as if we use the magnetic mallet. Again, because with the magnetic mallet you can perfectly prepare your implant site, but at the same time you can maintain the quality of the bone, and at the same time you can have this kind of result, the osseodensification. Here you can see how it's possible to work with the bone, in the bone with the magnetic mallet. You can see how it's possible to have a good penetration and of the instrument in order to prepare the implant side. And at the same time, you can obtain a perfect result. You can see on the patient how it was possible to work with magnetic mallet in a traumatic way for the hard tissue and for the soft tissue. So we can place our implant and the surgery is finished. So we can obtain this final situation. And we have this situation looking at the X-ray. Of course, we can also decide to make all on 4, all on 5, all on 6. And again, we can start from this situation, clinical situation. So we have to make the extraction, and if we want to make a all on 6, all on 5, all on 4 after the extraction, we need to be less invasive, less traumatic during the extraction in order to maintain, to preserve the bone where we want to place our implant. And because we know that we have to obtain a good result at the beginning of our surgery at the end. It means that we have to respect the Ragan-Vedra curve. It means that when we place an implant, we know that we obtain a good primary stability, is a mechanical stability. And then after the third, fourth weeks, we can have a good biological stability, secondary stability. That is the more important stability. But to be honest, we have a space within the third fourth weeks where we have a low mechanical stability, a very low primary stability, and in this period the secondary stability is just started to increase, to growing. So in this period we have not a good stability, and for this reason everyone tells us don't touch the implant in this period. So in order to avoid this situation, we have to reduce the space, and we have to work in order to have a longer primary stability and to increase the secondary stability. How we can work, how we can obtain this? First of all, we have to use a good instrument in order to prepare in a traumatic way our bone, in order to have a good primary stability of our implant. Of course, we have to use also a good implant in order to avoid the movement, the great movement of an implant, because we know that theoretically we must have only 100 and 150 micro movement. And from the second point of view, biological point of view, we need to have an increasing of our secondary stability. It means that we have to use an instrument that must be less invasive on the bone in order to have a quicker healing of the bone. Again, in this way, we can really obtain the best result. But in order to obtain this, we have to use the less traumatic instrument. And as I told you, it's impossible to be less invasive if we use burr or manual osteotome. The only way to be less invasive is to use an instrument that can help us to obtain a quicker healing of the bone and can permit us to have a good preparation of an implant site in order to guarantee a primary stability of our implants. And here I want to show what we did. So in this situation, we use a traditional level. Look at here. We work in a very, very gentle way, but when we finish, unfortunately, we obtain a damage of the bone because we had ankylosing bone, but look at here. We had a damage here. The other side, we use osteotome, and you can also magnetic mallet. And look at here how it's possible to manage also in the buccal zone our instrument. Look, without damaging the bone, maintain the integrity of the bone. So with the forceps, we can make the extraction of the bone of the without damaging it, and then we obtain this kind of result. So now we can start to prepare the mallet, the new implant site. Look how it's possible to prepare our implant site in perfect, maintaining the bone. And now we can place the right. Just form a very difficult situation, a very simple. We can place our implant, sure about our work. So if we analyze the X-ray, we can understand why we decide to work in this way. You can see that this kind of a situation is a very difficult situation because we have to make the extraction. We have a very bad quality of the bone, and we have in some places we have a damage. Like here, where we have a resorption, a very big resorption of the bone. So, of course, we have to choose what we can do here. We can make regeneration. Of course, the answer is yes, but we need to make more surgery. We can speak about a less invasive approach. The best thing is to be less invasive. And so we have to use the magnetic mallet in order to make the extraction and then to place an implant. Here we plan our surgery before the extraction. And here is how we finish our surgery. And here you can see the healing of the soft tissue and the final work. With the tips for the implant site preparation, we can also obtain the osseodensification. And why is important this concept? Because if we have this situation, where we have a great quantity of cortical bone, we can quite be sure that we can obtain a good primary stability, even if we don't have a good sponge bone. But we have enough cortical bone in order to ensure this mechanical stability. But when we have this situation where we have a very thin cortical bone, and so in this situation we cannot be sure about the primary stability, because also we have a very, very bad spongy bone. We have to transform this situation in this situation. We have to transform this bone in a very hard bone. So we have to change the quality of the bone. And with this magnetic mallet, it's possible to have a condensation of the bone in order to have a good primary stability, but at the same time to have a good answer of the bone. So in few words, we can say that magnetic mallet don't consume the bone, but just condense it. And here we know that there is a lot of articles that tell us how much is important this kind of principle. It's very important to transform this kind of bone in this kind of bone, to transform a very trabecular bone in a very hard bone. And here I can show you this very famous picture that I took from a work that was made using the Versa burrs. You can see how it's very similar. The final result using Versa burr is very similar to the result that we obtain using magnetic mallet. You can see how it's possible to obtain the same kind of ossidensification. And so you can again see from this X-ray how it's possible to change the quality of the bone. We decide to place an implant here, and analyzing the OPT, it looks very simple to place an implant here. But if we analyze the CT, it's possible to see 2 points. The first thing is that here we have a damage of the bone that it was impossible to see only with OPT. So it's necessary, first of all, to clean this damage and to make a regeneration. And when we make after the regeneration, we obtain this kind of bone that is good, but is not fantastic to place an implant. So our project is to place an implant here. To place an implant here, it means that we want to place a fixture there in order to have a good result. But we need to have a long-term result, a good result from the long-term point of view. So we have this kind of bone before placing implant, and look at here. After the using of the magnetic mallet, we place our implant, and immediately you can see here the ossidensification. You can understand how here we can have a fantastic primary stability, but also you can see in this image, X-ray image, how it's possible to have a fantastic secondary stability, biological stability. It means that we have really a long-term result. And again, if we go back to our case, clinical case, here you can see that we can place our implant. We can finish our work. We can again transform our bone in a good quality, and we can finish our work. In this video, you can see our surgery directly, so you can understand that we made the extraction and we make a ridge preservation using an heterologous bone. Now it's necessary to prepare here our implant site. And at the same time, we want to obtain an ossidensification. And with the mallet, it's possible to obtain this. You can see how it's possible to manage our implant site preparation. With one hand, we can manage the axis of our implant. We can have a good visibility. We can control every time our situation. And so we can, in the end, place the implant and we can lengthen it. In a very simple way, we can finish our surgery. And we can suture it. Then we can wait the healing of the soft and the hard tissue. So we can see before the extraction, after the ridge preservation, after the implant site preparation with the mallet. You can see how it was possible to change the shape of our bone. Sometimes it is necessary to make an expansion of the bone during our preparation, especially when we have a resorption of the bone. And again, in this case, I want to show you how it is possible to make a good implant site preparation. Look at here. Here you will see two different kind of approach. In the anterior part, it was necessary to make an ortho in order to move the central tooth, in order to create this space to place the lateral tooth, because here we had an agenesia of the lateral tooth. So we make ortho treatment in order to create the space, and now it was possible to prepare in order to place our implant site. But unfortunately, we have enough space from the crown point of view, but we have not so much space from the root point of view, and so it's necessary to use a very atraumatic instrument, and we used at that time the ultrasonic device. With ultrasonic device, it's possible to prepare in a perfect way our implant site, but unfortunately here it's impossible to have an expansion of the bone. Nowadays, I had to approach this kind of situation. I would prefer to use magnetic mallet in order to have a perfect control of my implant site preparation, and at the same time to have an expansion of the bone. Anyway, we finish our preparation, we place our implant, and we finish our surgery clinical case. Here you can see the healing of our surgery. So we started from here, and we placed in this very, very narrow space our implant. And here I want to show you the surgery, the video of the surgery, so you can understand how it was impossible to use this how traumatic instrument. And in this way, it was possible to manage our surgery. But as you can see, it was possible to consume the bone without obtaining an expansion of the bone. And this is the difference between an ultrasonic application, an ultrasonic surgery, and a magnetodynamic surgery. In this situation with the magnetodynamic, it could be possible to obtain a perfect preparation, a traumatic preparation with an expansion of the bone. But you can see the healing of the soft tissue with the temporary crown, and the final work with a good healing of the soft tissue and of course of the hard tissue. But you can see here the smile of the patient before the ortho application, ortho treatment before the surgery, and after the surgery. And now we decide to make the rehabilitation of this posterior part. Now you can see the anterior part, and as I told you, we decide to make the rehabilitation of this posterior part. You can see how much is thin the bone. You can see that here it's impossible to think to place directly an implant. So it's necessary to prepare in a traumatic way our implant site, but at the same time it's necessary to obtain a good expansion of the bone. And so you can see how much is thin. And here we decide to make this kind of approach with osteotome, and we obtain this expansion of the bone in a perfect way. We controlled this expansion, and it was possible to place an implant of 3.8 millimeter of diameter. This damage is not a problem. It's enough to place an heterologous bone filler and a collagen membrane, and we can have a good healing. Here you can see the surgery, the video of our surgery. Again, here we decide to create just a little split in the anterior part in order to enlarge our bone. And you can see how it's possible to manage this difficult situation, because we know that split is not so simple. And here we're using these tips. It's possible to prepare the implant site at the same time to enlarge. And so we can finish the implant site preparation. Instead, in the posterior part, it's enough to use directly the implant site tips in order to prepare and to enlarge the bone. Look at here. If we have this kind of situation, we can place our implant, we can place a membrane, and then we can finish our surgery. We wait the healing, and we wait the healing of the hard, soft tissue, and we can finish our prosthetic rehabilitation without problem. And starting from this concept, we can go deeper in order to understand how we can manage the split crest. Here you can see on this bone how it's possible to control the movement of the instrument, to control the force of the instrument on the bone in order to have a good separation of the bone without damaging it. Look at here, these cases. We decide to make the extraction, and then theoretically we decide to place an implant. But after the extraction, the bone was so thin that it was necessary to make a ridge augmentation and then to place an implant. Look at here, it is the situation at the beginning. Look how much is thin the bone before the extraction. Look. So you can understand that in order to avoid disaster, first of all, we need to make a traumatic extraction of the root. At the same time, it's necessary to have a healing of this sinusitis. But we can plan our implant surgery. We can plan our implant surgery in order to decide where we have to work with a great attention, where we have to prevent the resorption of the bone, because we know that there we would like to place our implant. And so we have to understand where we want to maintain the quantity of the bone and where is necessary to have an augmentation of the quantity of the bone. Here you can see the same patient, the CT of the same patient after the extraction and after the bone regeneration, the bone augmentation. And you can understand how it was possible to maintain the bone with a traumatic extraction, and in the other side, like here, it was possible to have a good bone regeneration. And in this situation, it's possible to apply the same planning that we decided before. So after analyzing the situation, we can decide to place our implant. So we can plan our implant surgery. And you can see how it's possible to manage without a problem our planning. But during the surgery, of course, we have to analyze all the situation. Look at here. You can see that the regeneration was good. Of course, it's necessary to clean it, to consume, to smooth the bone in order to have a good quality of the bone, a good quantity of the bone. Then we can start with ultrasound in order to be less invasive in the place where we had a bone regeneration. And after we can continue our implant site preparation with magnetic mallet. And again, you can see how it's possible to have a osteodensification and an expansion of our bone. So we can place the implant without problem. We can place all the and the posterior zone where is necessary. Right? We start to have the first cut because the bone is very thin with the ultrasound, and then magnetic mallet, as you can see, we can enlarge. We can go deeper in order to have also a sinus lift, and at the same time to enlarge the thickness of the bone. And now we can place the implant. We have to work in the same way in the other side, and so we can enlarge again our bone, our buccal bone, and then we can prepare the implant site with the magnetic mallet. In this way, we can control, and at the same time we can make sinus lift, and then we can place the implants. Now you can see the control of our surgery, X-ray, and the final works. Now we can speak about the tips for the sinus lift. Of course, we speak about crystal approach in this situation. Finally, when we have a crystal approach, we want to obtain this kind of result. Starting from here, we can change the floor of our sinus, and then we can want to have this kind of healing of the bone in order to place an implant to have this final result, a new bone. But this concept, we can summarize this concept into phrases. It means that we want to obtain a therapeutical effectiveness, and we want to obtain reduced morbidity. But using the traditional instrument, it's impossible to obtain this, because till now it was possible to use drill and the manual osteotome, and it's impossible to obtain this kind of less traumatic approach, because when we make a crystal approach, we do two kinds of surgery at the same time. We piercing a bone, and at the same time we make the elevation of the Schneiderian membrane. And for this reason till now, I think that it was valid, the Misch classification. In fact, in the 1987, Misch told us that using burr or osteotome, manual osteotome, we have to analyze the thickness of the bone. In few words, if we have a thickness of the bone equal or greater than 12 millimeters, is not necessary a treatment. If we have a bone height within 8 and 12 millimeters, is possible to make a mini lift. If we have a bone height between 5 and 8 millimeters, it's possible to have a lateral approach, not crystal, but lateral pulse, a single stage. And if we have a bone height equal or less of 5 millimeters, we need to have a lateral approach in 2 stages. So it means that it's necessary to, first of all, make a augmentation of the bone, and after the healing of the bone, we can place the implant. But we cannot approach the sinus lift with a crystal approach. But nowadays, using magnetic mallet, we can change our ideal surgery, because with the magnetic mallet we can do at the same time the perforation of the bone, elevation of the the Schneiderian membrane. And with the magnetic mallet, we have another advantages, because we know that if we use the manual instrument, the manual osteotome, we can have a vertigo situation. So it means that if I want to show you some clinical case, I can be probably more clear in this approach. So if we analyze this OPT of our patient, you can see that in the 2011, the patient had a good situation in this zone. In the 2016, the situation is going worse, and in 2018, it was necessary to make the extraction of these three teeth. And after the extraction, we make a ridge preservation. Here you can see the filler, and thanks to this material, it was possible to maintain a little quantity of bone, of course enough to place the implant, but good to give a primary stability to the implant. So we decide to make a crystal approach using magnetic mallet. Here you can see how we plan our surgery, and here of course is necessary to place two implants and at the same time to have sinus lift. And how we work it with the magnetic mallet. So in the anterior part, we work it with the magnetic mallet, with the tips in a tilted way, in order to go in a deeper way in the bone, and in a tilted way, and then we upright our tips in order to create a movement of the cortical bone inside of the sinus. In the posterior zone, we work in a traditional way, as Tatum, as Summer told us. So with the magnetic mallet, in a very controlled way, we make a crack of the internal cortical bone, and we make the elevation of the membrane. Here in this video, I want to show you all of this surgery in order to be more clear during our procedure. And so you can see here how we approach it, this situation. With the first tips, we work in a tilted way, as I told you, and when we arrived in the right position, we started to upright the instrument in order to create a movement of the floor of the sinus, in order to move also the Schneiderian membrane. At this moment, we use a more large instrument in order to create a osseodensification and an expansion of the bone. You can see here this bone. And again, I want to highlight how much is important osseodensification, because if we see this path of the surgical treatment, we can understand that in the 1981 it was very important to obtain the osseointegration. Then in 2000 it was very important to obtain the osseointegration in a less invasive way. But now in 2013, it was important to obtain also osseodensification. So it means that we want to obtain osseointegration, of course, but using less traumatic instrument like magnetic mallet, we can obtain osseointegration and osseodensification. Here you can understand what I was speaking about. Of course, if you want to, you can work directly with the burr. You can arrive to 1 millimeter, 1.5 millimeter near to the internal cortical bone. But look how much it's difficult to manage this situation. How much is full of risk because we are working in a blind way. You can do the Valsalva maneuver in order to see if we have the perforation of the membrane. And I suggest to do it also if you use the magnetic mallet. Now you can start to make the elevation. So I prefer to place vaginal membrane, first of all, gently with the low power magnetic side to side in order to make the elevation. And of course, when with this collagen can be placed here, and again with the mallet, the low power, we can push the sphere inside of our sinus. And using this instrument, you can see how it's much possible to control, manage really in a gentle way this kind of surgery. And now you can understand how is necessary to manage this situation. Look, this is the situation in which we are pushing. From this endosinus view, you can understand how much is important to manage this moment. Look at here. This is material. This is the Nigerian membrane. How is how I see here how much would be traumatic on this Nigerian membrane. So using the magnetic mallet in order to obtain the sinus lift, we can really manage at the same time the bone perforation and the sinus membrane elevation. And this moment we can place again, not finish out. So this moment we can manage the right way out. Look at here, it's possible to have an extension, an expansion of the bone, but we have to choose the best implant because, of course, we have to know that the implants are important from they are classified from macromorphology and micromorphology. So if we speak micromorphology, we have different kind of surface. And the surface, we know that is very important in order to obtain the secondary stability, biological stability. But also from macro point of view is very important. In the sinus lift, I suggested to use a taper implant with a good design, of threads. And thanks to magnetic mallet, probably now we can change the misclassification. We can see the misclassification in a different way. In fact, using magnetic mallet, we can say that if we have a bone height equal or greater than 12 millimeter, is not necessary a treatment. But if we have bone height within 8 and 12 millimeter, is possible to have a mini lift with magnetic mallet. But if we have the bone height between 5 and 8 millimeter, we can have a crystal single stage with magnetic mallet. So we change the approach. And it's more important when we analyze, like the clinical case that I showed you before, when we approach the cases with a bone height less than 5 millimeter or equal of 5 millimeter. So here now we can have the crystal single stage with magnetic mallet. Of course, we must have an implant primary stability. So if we finish the clinical case, you can see how we can approach the posterior zone, the second implant. As I told you, we use the classical approach. We use magnetic mallet in order to create a crack of the internal cortical bone. Then we place our material, and then we place our implant. So we transform the situation from this situation to this. This is the X-ray after the placing of the implant. But you can see how it's possible to see how it's changing the design of the floor of our sinus. Is completely changed. You see how is possible to obtain this kind of design. And so you can understand how it's possible to pass from here, where it's we can really see a very difficult situation, to here after our surgery, only using the right instrument. So you can see again the final result. You can see here how much bone we obtaining in this case using magnetic mallet. And so we finish our surgery in a good way. So in conclusion, we can analyze the clinical advantages of magnetic mallet. Thanks to the accurate movement of magnetodynamic instrument, we can have high control, precision, and safety during our surgery. After this, I want to thank all of you for being here. And I hope to see you again in some other other webinar. And please save, be safe, and don't underestimate this virus. Thanks again. Thanks a lot. And please save, be safe, and don't underestimate. Thanks again. Thanks. Okay. Before say hello, I want to answer to some questions that I received after this presentation. So the first question is, how does it compare with the piezotomy? Does it penetrate the cortical bone easily? So if we have to do a comparison between piezotomy and magnetic mallet, we can do this comparison, but they work completely in a different way. Ultrasonic instruments are able to consume in a gentle way the bone. Instead, the magnetic mallet is able to have a good penetration in order to compact the bone. So fundamentally, we have two different kinds of approach. With the piezotomy, it's possible to consume the bone. Instead, with the magnetic mallet, it's possible to compact it. The second one is if it's possible to make a comparison with the Versa drills. Yeah, it's possible to do it. Fundamentally, we obtain the same outcomes, also densification. But from my point of view, of course, with the magnetic mallet, it's more simple to manage the instrument. In fact, with the Versa, we use burrs, and so we know that we have a macro movement of the burrs, and we need also a great pressure in order to have a good efficacy of our instrument. Instead, with the magnetic mallet, we can manage the instrument only with one hand, and it's very simple to work with it. Also, it's not necessary to have a big pressure on the instrument, so we can control in a much better way the work of our instrument. Another question is, does the electromagnetic mallet damage the Schneiderian membrane inside with a minimal bone near the sinus? Well, the answer is quite simple, because I show I showed you before a case where I manage a sinus lift with only 5 millimeters, less than 5 millimeters. Of course, it's necessary to have a good skill in order to avoid the mistake that normally we do during this procedure. But if we use this instrument, it could be really more simple to manage this kind of procedure. Another question is there a difference in torque recommendation for implant placement after using magnetic mallet? Well, theoretically, it's a really good question. Theoretically, there is no difference. But if we analyze the bone after the preparation, we can understand that it could be useful to make a difference. I mean, if we prepare with a magnetic mallet, it's not necessary to make under preparation, as we do with the burr, in order to have a good primary stability. And so in this case, it's not necessary, because with a magnetic mallet, we have an osseous densification, and we have an elastic memory of the bone, and so after the use, the bone is able to close itself around the implant. So from my point of view, it's not necessary to have a high torque. Another question is, any contraindication to magnetic mallet, pacemaker, patient X? No, absolutely no. Another is, it's possible to traumatize the adjacent roots. Well, of course, if I beat the roots with a very sharp instrument, I can damage it, absolutely. Another question is, can you do immediate load on a ridge split? Well, the question is quite simple here, because it does not depend on the instrument. When we make a ridge split, it means that we open the bone, we enlarge the bone, and we place the implant inside. And we know that in order to have a host integration, we need to have a great stability of the implant. It means that the movement of the implant must be less of 150 micron. So it means that during a ridge split, we cannot ensure this kind of stability. And so even if we make the split crest with the mallet, I suggest don't do immediate load. Another question is, can you use guides with this technique? Yes, of course, and it could be really useful in order to place the implant where we plan our surgery. Absolutely, yes. Another question is, are you worried about having too much pressure? Sorry that I tried to read. About in the bone and resulting bone damage? No, is a very similar to the other question, so the answer is always the same. Absolutely no. I am not worried about this kind of pressure, because I can control the pressure, and also I can choose the best force in order to avoid the damage of the bone. So, of course, before starting my surgery, I analyze the CT in order to understand the quantity, but also the quality of the bone. And on this basis, I can choose the best forces of my magnetic mallet. Can you describe the patient experience? What does it sound like? What does the patient feel? Another question asks me if I can describe the patient experience. What does it sound like, and what does the patient feel? I wonder if it's similar to the automatic and manual condenser I used 20 years ago in the dental school. Okay, well, I started from the end. Is quite similar. The theoretically the instrument, but they were completely different, in a completely different way. Then the experience of the patient is fantastic, because if you saw some video during my presentation, you could see that it was, for them, it was nice, this kind of surgery, because they don't receive so high force like if we use hammer and osteotome. In fact, if you see the face of the patient is stop, doesn't move. It means that this bit is so fast that the patient can receive these forces like in the traditional way. Okay, there is a question similar to the first one, so the answer is the same. Okay, another very interesting question is this. I see there is no irrigation. Can you discuss heat generation? Well, it's a very good question, because it can permit me to highlight a big difference between this instrument and the other instrument. Because with this instrument, you don't need irrigation, you don't need water spray. It means that you cannot create overheating. It is fantastic, because when you use a burr, or when you use also ultrasonic device, you have to pay a lot of attention in order to have a good irrigation. Otherwise, you have the risk to obtain overheating, and so the final result as necrosis. In this way, using this instrument, it's impossible to create overheating, and you can work in very safety way. And this is one of the huge advantage of this instrument. The second question is very similar to the previous, and I can again about overheating, and absolutely there is no possibility to create overheating if we use in the right way this instrument. Well, there is another question about the difference with another instrument. Of course, is different because they work in a different way. We have here a magnetic movement, and is a trademark, so it's impossible to find another one equal, because it's a trademark. Only with the magnetic mallet you have the original movement. Why do we angle osteotome initially and then? Okay, this is a question about the sinus lift, the first cases where I show you this kind of approach. In this case, I prefer to start in a tilted way in order to arrive at the right position, at the right length that I have decided before on the CT. And in this moment, I upright the instrument in order to move the internal cortical hole in the direction of the sinus, in order to move the floor, the little part of the floor, of course, in the direction of the sinus, in order to move in a gentle way also the Snyderia membrane. And is very important. This is a technique that you can call localized management sinus floor. So another question is about the implant. Someone asked me if I ever put a parallel implant in the conical osteotomy. Of course, as I told you, I prefer to use a conical implant, where I prepare a conical implant site, because I have a perfect contact between the implant and the surface of the implant and the bone, in order to obtain a much better and faster osseointegration. Okay, now tell me if it's possible to use this instrument in the posterior inferior sextant infraalveolar nerve damage. Yes, with attention, yes. Someone asked me who makes it. Is an Italian company. Is the instrument is called magnetic mallet. The company is Meta Ergonomica. What's your preferred allograft material? Well, is not a webinar about the material for the filler, but I prefer to mix. Sometimes I prefer to mix homologous bone and heterologous bone, or sometimes I prefer to have the opportunity to use a good heterologous material. Of course, I prefer to use a material that have shown me with a lot of research the validity of his using. What about the shape? The type of specific. Okay, again, there is a question about the shape of the implants and the tips of the magnetic mallet. Well, of course, we know, and all of us know that the market is full of implant. It's full of the shape of implant. So theoretically, I suggested to use, if you prepare an instrument taper, the instrument, to suggest the implant that is very similar to these tips. Okay, it's quite late. I am very happy because you did a lot of questions, so I think that it was interesting for you, and again, I thank you for your attention. And after this question, of course, if you need more information, you can write directly to me or to the organizer of this webinar. And at the end, I want to thanks again all of you, and especially I want to thanks the Keystone Company for giving us this opportunity. And again, I want to wish you a happy Easter and say goodbye.